The number of young people and their families who are affected by mental, emotional, and behavioral disorders is significant. It is estimated that as many as 1 in 5 children and adolescents may have a mental health disorder that can be identified and require treatment.
Serious emotional behavioral disorders in children and youth include major depression, bipolar disorder, post-traumatic stress disorder. Others include oppositional defiant disorder, conduct disorder, and attention deficit hyperactivity disorder. Each of these can be identified relatively early and treated effectively, but if left untreated, they can create significant difficulties for the child or the youth in everyday life and can also place children, especially adolescents, at significant risk for suicide.
The majority of children with a serious emotional disturbance do not get the services they need. When they do, it's often too late, and the child has already entered the state's custody or has been placed in a more restrictive setting such as a residential treatment center or psychiatric hospital.
Many children, youth, and families don't get the help they need until it's too late. There aren't enough services to go around. Quality of the services is not what it needs to be. Stigma's attached. Children in need of mental health services are often the objects of ridicule, fear, and isolation. And finally, insurance companies and other funders typically wait until the problem reaches crisis stage and don't provide support for early detection and intervention.
Families and communities working together can help children and adolescents with mental health disorders. A broad range of services is often necessary to meet the needs of these young people and their families. These services should be comprehensive and community-based, allowing children to remain in their homes, schools, and communities. The system of care for children's mental health is the framework that works best for children and families.
A system of care is a way of providing services for children and their families that are non-fragmented, comprehensive, family-driven, culturally and linguistically competent. This is especially important as families are not often included in their children's care, and it's especially important for families of color.
In the state of Tennessee, it is estimated that 130,000 children may have a serious emotional disturbance. Half of the children in state custody and 84% of juvenile justice adjudicated youth 13 years or older have a formal mental health diagnosis. But those children have an advocate. Tennessee Voices for Children is an organization dedicated to providing education, support, training, and advocacy to families of children and youth with emotional or behavioral disorders.
Our mission is to speak out for the emotional and behavioral well-being of children and their families. We do this on 2 levels. We work directly with the families to help them get the support and services their child needs. And we also do this on a policy level to change and transform the children's mental health system that's now very inadequate and fragmented into a coordinated children's mental health family-driven system.
For over 20 years, TVC has been the statewide leader and national voice in promoting the development of a comprehensive system of care for children and families in Tennessee that is child-centered, family-driven, community-based, youth-guided, and culturally competent.
TVC doesn't believe in a one-size-fits-all approach. We approach families in a way that is strength-based, that is respectful of their culture and what they want for their family. We help them navigate the complex children's mental health system to get the services and the supports they need to be able to keep their child at home, at school, and in the community.
Here at TVC, we believe that parents have control of their own destiny. We also believe that it's important that the families have a buy-in. We respect that buy-in, we respect what a family needs, and we assist them in doing whatever it takes along with them to making sure that they are successful in their definition. Success is important, and that's what we pride ourselves on, and that's what the families pride themselves on.
TVC has helped our family to be able to sit down and talk about our problems. They've been able to give us a lot of input that we've been able to use as tools to improve our family life. There is a lot more respect within our family. Our son is going to school and earning good grades, and basically we have a situation now where we can avert crisis by using the tools they've given us.
TVC has helped me to understand that when you take small steps, they can turn into big steps. And it has also helped me to understand that if parents have rules, things can be a lot better. And so since TVC has helped me to understand that, me and my mom have done more things than we have ever done before.
TVC also employs parents as family support providers and advocates to assist other parents of children with mental health diagnoses based on their experiences in the child-serving systems.
Here at Tennessee Voices for Children, all of our family support providers have a story of our own, whether through juvenile court or we may have children of our own that have mental health needs. This allows our families to become very relaxed with us, and this gives them a great sense of hope.
TVC has been a leader in the movement to implement a family-driven system of care throughout the state of Tennessee and the nation.
The system of care goals are the same goals that we all as parents have for our children. That our children are as healthy emotionally and physically as possible, that they live in caring families, that they thrive in communities, that they have healthy relationships, that they are successful in school, and that they are able to reach their potential and their promise.
TVC message of hope is like a flower. It will grow if we water it. I refuse to let my diagnosis affect my future. I will be an outstanding writer one day.
Tennessee Voices for Children believes there is hope for children who have mental health issues and their diagnosis is not their destiny. For more information, contact Tennessee Voices for Children today or visit tnvoices.org.